Hi, I'm Ellie. We're here at Shellharbour City Libraries, and this is Rhyle. Rhyle's from Harbour Health in Shellharbour. Do you want a little bit of introduction for yourself?
Thanks. I'm Rhyle Baker. I'm a psychologist in Shellharbour Village. I run my own sort of solo practice called Harbour Health Psychology and Clinical Services. We've been there in Shellharbour Village for about 2 years now, and then sort of provide psychologist services for adults in the area and sort of support all across the Illawarra. That's me.
Nice. And this is just going to be a series of videos, some casual conversation about when to seek mental health help and how to go about this and how to support your friends. So, first off, how does one know that they aren't coping? What are some signs to look out for?
Yeah, I mean, I think we're looking for changes that are out of the norm for people. So often cases, there's probably going to be a lot of withdrawing and sort of shutting down, a bit of isolation, and also maybe just changes in terms of how they're, in your friendship group. If they're normally really bright and bubbly, you may not be hearing from them as much. They may not be as sort of engaged when you have social catch-ups and things like that. I guess for people individually, like being on the lookout for sort of critical thinking, low motivation, just sort of feeling a bit out of it, out of focus, maybe procrastinating a lot more.
Yeah.
All of those things are going to be kind of signs that, oh, hey, maybe something's a bit different for me.
Yeah.
Just a bit of early warning signs for your mental health.
Yeah, okay. Is there kind of like a time frame or guide to this, or is it a bit random?
Yeah.
Like you can't really put a time frame on it?
Like diagnostically there is, but I would say for everyone, like, intervening early is key, and really helpful. So even if you notice some changes happening over a week, like it's a good opportunity just to connect with your friends. Certainly if it's kind of getting into a week, 2 weeks, a month or so, and you're noticing these things change, it's a good time to really reach out and get connected with some support. So I wouldn't say black and white this time.
Yeah.
Just when you notice it, when you're aware of it, try and do something about it.
Yeah. And once you accept that you need help, what is that next step? So, doctors, or do you go straight to psychologist, or?
Yeah, I mean, I think if you have a really good support network in place, reach out there, and talk to your friends as soon as you can. Often when we sort of reach out to our mates and people around us, family and friends, we sort of get some of that support that we need.
Yeah.
If you're at that stage or time where you want to engage in some mental health support through psychologists and things like that, your doctor is a great place to go, because it also just increases your sort of team around you who are supporting you. From there, you can book in an appointment with your doctor. You could get that sort of referral to see a psychologist. But that also is not needed to talk to psychologists or counsellors or things like that. You can just do some research, or if you know a recommendation or whatnot, call them up directly and sort of say, hey, I'm going through this, I'd love to connect. What can we do to sort of start, the process? So don't delay, don't think you need to see your doctor first. Just when you're ready, whatever time that is, jump on it and reach out.
And we'll put some resources at the end for things like Lifeline. And how can you overcome the barriers to starting the process of seeking help? Let's say to do with the cost of it and privacy and confidentiality in like a small town, and how to express how you feel to people that you're needing support from.
Yeah, I mean, I think there's a lot of difficulty in ourselves when we think about accessing help, that kind of stigma that's maybe sat there across generations up to now. I'd like to think, like, as a society and as a friendship network, we're a lot more accepting of it. So hopefully that's less and less for people. Barriers around costs and things like that, of course, in today's world is really hard. There are a lot of free resources and free services out there as well. Even just down here in Shellharbour, they've opened up Head to Health, which is kind of more of an adult-based free government-funded mental health service. And then of course things like Lifeline, Sane Australia, Carer Gateway supports, things like that, are all sort of government or large organisations that offer complementary services. So definitely worth getting in contact with them. And then I guess as well with costs, sometimes it's a bit of research. Finding a psychologist, counselling setting that works within your budget too, or if you're looking in particular for bulk billing, might be able to offer that.
Cool. And can you explain to us about the Medicare rebate system to do a psychologist and getting referred from a doctor?
Yeah. Just like with a lot of health services, Medicare can provide a bit of a rebate on your fee. So often cases for psychologists in the private practice setting, there's often going to be a set fee and then a gap that you might pay on top of that, unless they're a particularly bulk billing psychologist. Simply seeing your doctor, talking about your mental health, doing a mental health care plan and getting a referral will set you up to be able to access a rebate on services that you can then take to your psychologist and say, hey, can I get this portion covered with my services here?
So reduce the cost, make it more accessible.
Up to 10 sessions within a calendar year. Medicare will support you with, and at the moment for psychologists, it's around $96.35 come the new financial year. That's kind of getting rebated. So
That's great. Okay, cool. Thanks, Rhyle.
Fantastic.